Hi, I'm Tom Lynch, Two Things. Today I'm joined by Sarah Wakeman from our Department of Addiction Medicine and Dr. Ali Raja from the emergency room. Sarah, we have a new law in place from the state on how we prescribe opioids. What are the big differences for our doctors?
So the big pieces are in treating acute pain, we want our doctors to use opioids only in settings where other medications are not going to work, and for the shortest amount and at the lowest dose necessary to keep that patient comfortable.
And Ali, what are the implications of this new law in the emergency room?
You know, the law actually has a couple of big implications in the emergency department. First, actually, I should point out that the law was partially developed by Dr. Wakeman, so she was on the team that helped put this together. And with the partnership with the substance use disorder system here that we have that Dr. Wakeman helps lead, and a partnership with the Bridge Clinic, we're really able to offer our emergency department patients with opiate use disorder a place to go, which they never had before. The other thing that's really important is that we're actually able to tell them that we have a limited amount of opiates that we're actually able to prescribe. So we simply can't legally prescribe this large amount of opiates that may have been prescribed by either us or other clinicians in the past.
Now, Ali, I've spent time with you in the emergency room, and I know that you're an incredibly busy clinician. How has this law actually impacted your personal practice?
So what it's actually done is it's given us people to call. So now that we have a requirement of a substance use disorder evaluation for every patient who comes into the emergency department with an overdose, it's actually given us the ability to help those people find a place to go afterwards. So for example, if somebody comes in with a heroin overdose today, I'm required by law to give them a place to go. For a lot of places that's really difficult. But fortunately at MGH, we've got the Bridge Clinic, we've got the teams that Dr. Wakeman's put together, and I can give them a place to go that they can actually go to break the cycle.
And Sarah, the prescription monitoring program, we have a new state prescription monitoring program, and I heard yesterday from David Ting that it is now linked to Epic. Have you had the chance yet to use that and use that link in Epic?
So there is a link in Epic. Hopefully we're going to get it even more tightly integrated into Epic. But yeah, the new system is called the MassPat. It's much more user-friendly than the old system. It's much quicker, it's much easier to search for patients, and down the road we hope that it'll actually be integrated to the point that the clinician doesn't have to enter any information, but actually can, in the patient's chart, just access the MassPat directly.
And what does the law say now about how our doctors have to use the PMP?
So currently you have to check it before prescribing an opioid for the first time for any patient or for a new patient. But starting October 15th of this year, you're going to have to check it before every Schedule II controlled substance prescription. So
And
that
that's
will be a huge change in practice.
And that's true even if you're a cancer doctor or a pain doctor or a hospice physician.
That is true for everyone.
Okay. And what's the impact do you think that will make?
Well, I think we need to make that easy for doctors to do. It absolutely is best care. So even if you're an oncologist, if you're prescribing oxycodone for someone with lung cancer, if they're also getting methadone from another prescriber or benzodiazepines from another prescriber, you would want to know that to keep your patients safe and make sure they're getting the best care possible. We need to make it easy for our clinicians to do that every time they write a prescription so that we're not adding to their administrative burden.
Great. Sarah and Ali, thank you so much for the work you do every day. We know that the opioid crisis in this state is incredibly important. The governor has made it one of his leading initiatives, and certainly one of the leading initiatives of the MGH and the MGPO. I'm Tom Lynch. That's Two Things.